During the oath of office, Njoko charged Peters to uphold professionalism, transparency, and dedication in the discharge of his duties. Now, he emphasized the importance of teamwork and commitment to the developmental agenda of the present administration. In his acceptance speech, the Secretary to Council, Gospel Peters, expressed gratitude to the HA chairman for the confidence reposed in him and pledged to work diligently to support effective governance and service delivery in HA local government area. While in Degema local government area, stakeholders of Bakana are appealing to Governor Siminalayi Fubara to consider an upgrade of their traditional stool from second class to first class status. The stakeholders, including chiefs, elders, opinion leaders, women groups, the CDC, and youth groups, made the appeal at a town hall meeting in Bakana, organized at the instance of the Amayanabo of Bakana, King Lawrence Odom Barboy, and his council of chiefs to foster unity and peaceful coexistence among the people. Speaking at the event, the CDC chairman of Bakana, Dr. Victor Akidi, a member of the Bakana Council of Chiefs, Marie John Miller, and a woman leader, Dina Braid, among others, said the Bakana traditional stool deserves an upgrade to first-class status, given its historical importance in years of existence in Kalabari land.
The Bakana traditional stool was the first to depart the old shipping in 1881 and be settled in its present location. It is against this backdrop we make this heartfelt and passionate appeal to Your Excellency, the Governor, to kindly consider an upgrade of the Bakana traditional stool from its present second-class status to first-class status for the preservation of our ancient history.
We are pleading with His Excellency that the Odum stool should be upgraded to first class, to have that sense of belonging among the League of Communities, towns in Kalabari land.
We also want to use the opportunity to appeal to the governor to give us the consideration of recognizing our stool as a first class.
The Bakana stakeholders also expressed satisfaction with the steady progress of the Trans-Kalabari Road project being executed by the River State government. They commended Governor Siminalayi Fubara for his commitment to ending the long-standing challenge of road access to Bakana.
For hearing our silent, age-long cry of 145 years by awarding the construction of the Trans-Kalabari Road linking Bakana to Port Harcourt. We wish to unequivocally say thank you for braving the odds, breaking the jinx, and bringing us closer to feel the effects of governance and development in River State.
By this singular act of opening up Bakana to the world for progress, we appreciate him. He has given us what we have not for a very long time seen in the history of Bakana. Since 1881, he has given us this road. An island community on or before December experienced cars driving on solidly constructed road into Bakana. That is unimaginable.
Our correspondent reports that the stakeholders also lauded the Amayanabo of Bakana, King Lawrence Odum Barboy, for convening the interactive town hall meeting, noting that such a strategic gathering of stakeholders had not taken place in the community for decades. Let's take a quick break now. When we return, President Tinubu deploys troops to Kwara after deadly terrorist attack. Stay with us.
This is the news on 92.3 Nigeria Info.
You're welcome back. Now, President Bola Tinubu has ordered the deployment of an army battalion to Kayama local government area of Kwara State following the deadly attack by suspected terrorists on the Nuku and Woro communities on Tuesday. In a statement issued on Wednesday night, Presidential spokesperson Bayo Onanoga quoted President Tinubu as saying the new military command will spearhead Operation Savannah Shield to checkmate the terrorists and protect defenseless communities. President Tinubu urged collaboration between federal and state agencies to provide succor to affected residents and ensure those who committed the atrocities do not go scot-free. Now, the Kwara State government said 75 residents were killed by the suspected terrorists during the attack. Well, the convicted leader of the indigenous people of Biafra, Nnamdi Kanu, has filed a notice of appeal at the Court of Appeal, challenging his conviction and multiple sentences imposed by the Federal High Court in Abuja. Kanu is insisting that his trial was riddled with fundamental legal errors and amounted to a miscarriage of justice. At the notice of appeal dated February 4th, Kanu said he was appealing against his conviction and sentences on 7 counts, including terrorism-related offenses for which he received 5 life sentences and additional prison terms after being found guilty on November 20, 2025. In his grounds of appeal, the IPOB leader accused the trial court of failing to resolve what he described as a foundational disruption of the original trial process following the 2017 military operation at his Afara-Oku residence. Well, back here in River State, operatives of the Ozuoba Police Division have arrested Frimpong Samuel for allegedly removing the roof of his tenant, Ifechukwu Anozie, along NTA Road, Port Harcourt. Samuel reportedly took the action after Ifechukwu failed to vacate the property 2 weeks after his rent expired. Speaking on the incident, the spokesperson for the River State Police Command, CSP Grace Iringi Koko, said the landlord will be arraigned in court upon completion of investigation. Meanwhile, the tenant, Alozie, said his landlord served him a notice in December asking him not to renew his rent. According to him, his landlord said he plans to renovate the apartment. Anozie explained that his rent was due to expire in January 2026. He explained that he appealed to the landlord for a 14-day grace period to enable him move into a new apartment he had already paid for. Anozie expressed shock that before the expiration of the 14 days, his landlord came to the apartment with a carpenter and removed the roof. He claims the action exposed his properties to the rain, destroying several items, including his academic certificate. He is now calling for justice over the incident.
On the 1st of February 2026, I showed him transaction payments that I made for a new apartment and pleaded for 14 days, which will elapse on the 14th of February to move out of the house. But to my greatest surprise, at about 8:02 a.m., my wife called to inform me that the landlord has de-roofed my apartment. Few hours later, it started raining heavily with all my properties, documents, and certificates all exposed in the rain. My pregnant wife and my 2 kids of 2 years and 3 years were exposed too. All my properties worth 25 million naira got damaged.
Well, away from that to health matters now. A visit to some primary health centers and private hospitals within Obiakpo and Port Harcourt City local government area shows they do not have snakebite anti-venom. Now, this comes amid concerns following the death of an Abuja-based singer, Ifunanya Nwangene, popularly known as Naya, who reportedly died after suffering a snake bite at her residence on Saturday. Correspondent Rejoice Amadi spoke to some healthcare workers at these facilities who blamed the lack of anti-venom on poor power supply, storage challenges, and the low incidence of snake bite. A medical doctor at one of these centers who spoke anonymously stressed that anti-venom remains a life-saving medication and its essence should not be excused with low incidents of snake bite. The doctor explained that medical personnel across various facilities have repeatedly appealed to the government to put better systems in place to ensure that essential but rarely used drugs are available when needed.
Most hospital pharmacies don't deem it fit to stock the antivenom. The snake bite case is not so popular, and so they don't feel it's important to. It's like an extract, so you can't keep it. You have to store in a refrigerated place. Yeah, those are one of the things that we are, among other things too, that we are clamoring for. We need to still stock the shelves with it. It's something that is necessary to. They should at least have a control mechanism where even the ones that you don't use, you can return.
Meanwhile, a health worker at one of the private hospitals told our correspondent that it does not stock antivenom but relies on collaboration with the University of Port Harcourt Teaching Hospital whenever the medication is required. Reacting to the situation, the chairman of the Nigerian Medical Association River State Chapter, Dr. Tamunokoro Diamond, said the most practical solution to the challenge of antivenom availability, especially in the absence of reliable power supply, is the establishment of designated centers strictly for storing the medication. He told correspondent Martha Okere that patients can then be referred to such centers whenever the need arises.
The antivenom is thermosensitive, so it needs to be preserved in a temperature that keeps it at the highest potent level ever. And because they are not common, sometimes when you store it, after a while it will expire and it's not used, I think that the best solution is to have some centers where we can store this antivenom, where patients can be referred to immediately those bites happen so that they can have access to them.
Dr. Diamond also advised residents to take preventive measures against snake bites by being mindful of their surroundings. He added that one of the responsibilities of the NMA this year is to reach out to communities, particularly in rural areas, to sensitize residents on basic first aid measures. He also called for the training of health workers across various communities in the state.
And this year I mapped another 5 local areas to visit. The aim educate them on common diseases that we see in the health facilities, and to let them know what steps they can take before they get to hospital, and to also let them know hospitals that are nearest to them, closest to them, for them to access health facilities. But beyond that, I think that we should also have some more training, for health workers. So we are doing some more, and then hands need to be on deck, including community leaders, to see how we can improve on that.
Well, as you may know, the Senate has called on the Ministry of Health and Social Welfare to make the stocking of essential antidotes a mandatory requirement for the licensing, registration and renewal of accreditation of private hospitals. It also wants the ministry to ensure adequate budgetary provisions and efficient supply mechanisms for public hospitals across Nigeria. The Senate further directed the Federal Ministry of Information and the National Orientation Agency to embark on nationwide public sensitization campaigns on the importance of prompt hospital presentation after snake bites and poisoning, as well as the dangers associated with delayed medical treatment. Well, in another development, the River State government says it is investing in the training of healthcare professionals and upgrading health facilities to provide better cancer care. State Commissioner for Health, Dr. Adezore, said this on Wednesday as the world marked Cancer Day. Ore said many forms of cancer are preventable and many others can be successfully treated when detected early. Well, she asked the Rivers people to utilize available screening services and to overcome fear, stigma, and misinformation surrounding cancer. She is also urging all residents of River State to adopt healthy lifestyles and to prioritize regular medical checkups, adding that early detection saves lives.
Our focus includes improving cancer prevention programs, expanding screening and diagnostic services, and ensuring treatment and care are accessible and affordable. Prevention is a key pillar in the fight against cancer. Avoiding tobacco use, limiting alcohol consumption, maintaining a healthy diet can significantly lower cancer risk. Early detection saves lives. Cancers such as breast, cervical, prostate, and colorectal cancer have better outcomes when diagnosed early.
Meanwhile, at the River State University Teaching Hospital, where a commemoration seminar was held, a cancer survivor, Dayo Ojo, shared her experience with breast cancer, saying there is a need to raise awareness that people are surviving cancer. She said sometimes people do not show up for treatment because of the fear and misinformation.
When you are out in the field, living your normal life, you can tell people that I have met somebody who survived breast cancer. Some people say, oh, don't go for chemotherapy. Chemotherapy will kill you. When they come to me, I say, am I dead? I am alive. Chemotherapy is not an easy thing to go through, but I survived it. But you have a role to play. The first thing is for you to be very observant with your body. Are you observing anything that is not normal to you? You need to take that seriously and not just wave it off and assume that it's nothing.
Correspondent Martha Okere reports that the theme for this year's Cancer Day is United by Unique.
And now we bring you news from around the world.
The US and Iran have agreed to meet in Oman on Friday to talk. The two countries are not in agreement on what to discuss. America wants Iran to talk about its missiles, but Iran says it will only talk about its nuclear program. This meeting is happening at a tense time when the US is sending more soldiers and weapons to the Middle East. Now, many countries in the region are worried that fighting could start and spread to many places. Well, on the news this morning, you heard Governor Similai Fubara has assured Rivers people of focus amid political tension. You also heard that the Senate has passed the Electoral Act Amendment Bill and has retained the electronic transfer of result. We told you that President Tinubu has deployed troops to Kwara after a deadly terrorist attack. A visit to health facilities in Port Harcourt has shown that they do not have snakebite anti-venom. On the foreign scene, US and Iran have agreed to Friday talks in Oman. The news was edited by Martha Okere. To reach the news team, send an SMS or WhatsApp to 0808 721 7215. I am Ifechukwu Muonyili. Many thanks for listening.